So I've heard a lot of amazing ideas. I mean, we clearly know we have a critical challenge to address the workforce shortage. We simply cannot deliver on the tenets of value-based, accountable, equitable care without a culturally competent workforce. Cultural competence, I mean, with the research empirically shows that if you have a care team that's reflective of the shared lived experience, ethnic attributes, other characteristics, they're embedded in communities, the outcomes are better. We've talked a lot about, how do we go about building a robust pipeline of talent? How do we approach diversity? I also, one reflection I had just on the comments that have been made so far, now workforce is apparently the #1 issue that's top of mind for health system CEOs. There was an Accountable Care Healthcare, American College of Healthcare Executives, ACHE, they had an annual survey of health system CEOs. And for the first time in 13 years, financial challenges were not on the top of the list. And keep in mind, they're dealing, health system CEOs are dealing with inflation, supply chain issues, staffing costs. Obviously, that's inextricably linked with the shortage. I mean, we're seeing, temporary, travel nurses come into hospitals, but they're really thinking about how do I address this critical workforce need. It's not only a shortage, but it's also engagement. It's addressing burnout, moral injury. I wanted to take our conversation, and I'm going to hand this over to Rashmi here for the next question, but we've talked about the importance of diversity and inclusion within the pipeline and building that culturally competent workforce. But I wanted to kind of look at the other angle of this. How can the universities, higher education institutions, better support these underserved learner populations? Rashmi, I'll go ahead and hand it over to you to finish that up.
Yeah, and coming from a different country, I've been in the Valley for the last 10 years, but I come from India. What I see is that there are primarily 1 or 2 industries that thrive in RGV. It's usually healthcare, and then there's food industry, right? Those are the 2 things that come up. How can we diversify in that and work on more workforce retention? Because there are a lot of people who move here and they leave. And it's because there's limited industries, limited jobs, there are only so many things you can do, and that's what our kids learn. They only see hospitals around, so do they only become nurses and doctors? How do they get exposed to the fact that there is so much out there? What are the different educational pathways out there? So, who would like to start? Judge, you're my favorite. We'll start with you.
Well, we're not an educator, but let me tell you what I've told my staff in the Prosperity Task Force. The starting step in the solution is you have to identify the target that you're trying to help. If you don't know who they are, where they are, and how to reach them, then you can't help them. Okay? And that's a living document. People move in and move out. So our task #1 at Prosperity Task Force is to identify the people that are either underemployed or unemployed, so we can move them into a better position. Then I want to go to column C before I go to column B. Column C is what are the jobs that are already here, and what we're finding out is 120,000 of the jobs that Hidalgo County has are people that are working, but they're still earning below poverty level. Okay, so in order for us to help the uncompensated time of a lot of our people that live here, we need to fix that. And what we're finding out is when we're trying to match column A with column C, okay, sometimes we're seeing 2 problems. One is they're not qualified for some of the jobs, so we need to improve on that. And number 2, they won't accept the job. Because after COVID, they received so much money and they're receiving so many benefits. 31% of our people are receiving benefits. So the margin of working and the margin of what you're receiving in benefits is very small. Then you can remove those people from the workforce line because they're not going to take a job. Huge problem. But in order for us to be able to be competitive, we've got to form column D. Column D are the jobs that we don't have here that we should have here. And all of that takes time and information, and that's why we had been waiting for somebody else to solve our problems, and they didn't. So that's why we formed this Prosperity Task Force, and that's exactly what we're doing. What we also found out is, and I think all of you in education will agree to this, is that a freshman that goes to college without a mentor has the least probability of becoming a sophomore than the one that goes to college as a freshman with a mentor. So mentorship becomes very important because a mentor helps you make better decisions. So if we have people that are non-achievers or low achievers, assigning a mentor to that individual is going to help them make better decisions. So I think that's part of our solution is to make better decisions, and I think that the targeted people we're trying to help, we need to have that mentorship program. And we also need to identify the factors that are keeping somebody here. We can't help everybody, but what do you do with a 28-year-old that's working, married, and has several children? I mean, how can he leave whatever he's doing to improve that thing? Well, it's an issue and a problem, but we cannot just continue to define the problem. We have to find solutions to the problem. That's why this Recompete grant and working together and showing success. If you have a pyramid of the people we have here in Hidalgo County, out of that 120,000 people that I think are underemployed, 6% are college graduates. 6% are college graduates, 19% have some college, 25% have high school, and about 49% have no school. So in order for us to try to gain that confidence that we know what we're doing and that we have a high probability of success, let's work from the top of the pyramid first. Okay? It's easier to find good, suitable employment for the top of the pyramid than to start from the very bottom. So we're trying to help. We're trying to help solve a very complex problem that hasn't been solved in many years, but we all know that the answer is education. The answer is building that human capital, and it's creating that human capital. Human capital will solve the problems, and we can create it. So that's what we're trying to do in the Prosperity Task Force.
Thank you, Judge. I think that we should take note of the consistent growth here in the Rio Grande Valley, because with that consistent growth, it has parlayed into growth in different industries. Heavy manufacturing in the Port of Brownsville. If you've not been to the Port of Brownsville recently, you need to make a trip over there. It's electric right now with the growth over there, and there's a lot more to come. Light manufacturing around the whole valley. I think we also need to commend our colleges, our local colleges, South Texas College, Texas State Technical College, Texas Southmost College. They have programs, certification and licensure programs that are absolutely fitting the demand that's growing here in the Rio Grande Valley. And you're talking about electrical work, plumbing, scaffolding, all different kinds of trades. And these folks are coming out and they're making sizable income right off the bat. I always reference the scaffolding program at Texas Southmost College. They're coming out making $75,000. It's a 9-week program, right? And that's just one program of many. I've gotten a chance to tour South Texas College. Ricardo Solis and his team are doing a phenomenal job as well. But our high schools are doing a good job too. They have certification and licensure programs that are growing, that are going to help us meet the demand, Judge. And these are good paying jobs that will hopefully impact the poverty levels and lines of our folks living here in the valley. But I do think it's incumbent upon us as higher education to also be flexible enough to always be willing to sit down with industry or community partners and understand what the new demand is, because quite honestly, the demand of today is not going to be the demand in 3 to 5 years. And it's we're big and we're not fast a lot of times, right? But we're gonna have to develop a need to be more flexible from an education perspective, to always be willing to sit down, listen, and then create the programs to meet the new demands that are coming our way. And that's the way we're going to address, hopefully, issues related to poverty. I love quoting my little brother, Dr. Nolan Bandis, who's very fond of saying, listen, in the Valley, we have so much more talent. It's not yet matched by opportunity. And until our opportunity matches the talent, we're not even close to being done. But I also like quoting my other brother, Julian Alvarez, who's very fond of saying higher education is any education after high school. I've asked him for permission to tweak that a bit, and the tweak is simply this. It's any higher education is any education because you can get it in high school now and after high school. Any education that leads to a certification or a licensure or to a degree program that we offer, et cetera. So I do think that, Rashmi, that you're seeing more industry growing here in the Valley, and it's not retail only, right? It's industry that's offering higher paying jobs, and that's how we're going to address the poverty issue, I believe.
I completely agree with that, and as a university that stretches across the entire region, you know, we've seen what's happening in Brownsville and at the port and LNG and SpaceX, and these types of industries are creating new jobs and new opportunities. We've had partnerships, for instance, with EDCs where they have asked for our students to do a project for them that might be creating software or some working with AI, things that are going to then lead to another creation of jobs. And you know, you have all this sophisticated equipment now in hospitals and others, and you need the people that know how to repair that equipment. You know, the people that know how to best operate that equipment. And so I think there is space for everybody, from the technical schools to the 4-year and beyond, to have jobs. We also are doing things like trying to partner with nursing schools and others that have, they have coders, they have people, radiologists, techs, they have others that then we put them to work in our clinics, because the best experience you can have is when you're on the ground doing the work. It will let you know whether you want to do that job or not. And they can do it and get paid for it. And then a lot of times they decide, I do like this and I think I want to go beyond it. So like now we have a 15-month accelerated nursing degree for those who have gotten a degree in something else, but decide afterwards, I think I want to go into nursing. And so we try to make it faster. They don't have to go back and do a whole 4-year degree. They've already gotten all the basics. And so it's a 15-month accelerated degree. So there's a lot of ways to be creative. We use the data, and I know that everybody in higher ed knows this. We can't start a degree program until we've gone through the coordinating board and they've assessed that there's a need for that particular degree, so that we're not wasting time and putting students in seats where there's not going to be any jobs for them. They look at what's available in that area. But I do think we need to grow the different industries that are here in the Rio Grande Valley.
And I think, building on that, it really does take kind of looking at it from 2 angles. I think probably more than 2, but 2 general angles. You know, if you look at it from K through 12 and you're asking how do we diversify that? Well, in K through 12, if the students are only seeing one type of opportunity, if they're only seeing healthcare, if they're only seeing education, that's all they're going to go through. And as a former K through 12 leader before I went into nursing, you really do have to work with those students and really show them all the opportunities that are out there, but not only show them the opportunities, show them the pathway to get to something different. It's really identifying early that this individual has this interest in IT or in something related to business, and it could be healthcare or education, but you're really looking at all those opportunities that student has, but then working with our higher education partners to ensure when they're taking those dual credit courses or where they're taking those advanced learning courses, to ensure that our higher education institutions are going to take those so that our students are really going through that and actually able to accelerate their learning. They're able to come out and say, okay, I got 60 CUs, I actually achieved my associate's degree in high school, but does it actually apply to the degree you want to go into, the area you want to go? Did you end up getting 60 CUs, but now that higher education institution's only going to take 20? We really have to come together to solve this and say, if you have gotten that associate's degree, if you've achieved that skill, then we can now move you forward more quickly. Why do we continuously make you repeat things that you've already done? And that's a really big commitment for us at WGU, is always to take that work that you've already done. That said, also, sometimes you get out there in life and you've got a degree and you're moving along. And again, as a former teacher who is now a nurse, you decide you want to do something different. And I did that accelerated program, and we are also doing an accelerated nursing program. But those are those reasons you do that, but it shouldn't just be there. It really should be everywhere. So if you want to transition, so as new opportunities are arriving in the Valley, we want to make sure that we can very much quickly pivot this, maybe mid-level skill, maybe they don't have any education, whatever the case may be, but work to put people in those jobs that we have as quickly and as efficiently and competently as possible. Because that's really how we're going to grow and change it. Because again, until the generation coming up sees the opportunity ahead of them, they're not looking for it, they're not moving towards it, and we're not building pathways for them to get there quickly. So it's essential we start that early.
I wanted to make one more point, because there's some times that things are right there and you just aren't seeing it, right? It is so obvious, like for instance, and I think our dean is here, he asked a question earlier, Dean LaFontaine, he heads our School of Podiatric Medicine. We saw the high rates of diabetes down here. Everybody has seen the high rates of diabetes in the Rio Grande Valley. Across the country, they know it. But there's so many amputations and blindness and other things that come from that. Well, we didn't have a podiatry school, so we started a podiatry school. We're the first podiatry school in the entire state of Texas. We're only one of 11 in the nation. And so we need that. We need a podiatrist on the team to help prevent the amputations, right? Because a lot of times by the time the patient gets to the orthopedic, it may be too late. It may be time to amputate. So working alongside and having this integrated care where you get everybody on a team together, I think that's when you really come out with the best outcomes for the patients.
Can I add one more thing as well? Because it's a reflection observation right now. We're talking about making sure we understand what the demand is on a per industry basis. It's a no-brainer with healthcare. Every single component right now, all allied health is in demand, right? So I would hope we'd all support each other as we're developing new programs that are going to benefit our communities, because there's not a question whether or not we need new programs, right? And so, and I think, I hope that hits home with folks here, because the demand is that extreme right now. And I had to grin when you indicated or basically said that the CEO's major concern right now is labor force. If there were a little comment part under that, it would be finance related to labor, right? Because that's the only way you're recruiting folks right now, is trying to match and rematch and rematch. And it just blows your financials out of the water, Judge. It's not a pretty picture right now. And so I absolutely can concur that labor right now is at the top of the list for CEOs.
And I wanted to say on that too, is even as we're talking about allied health, because it's essential, we need allied health. Allied health, many allied health professions require clinical placement as well. And I don't think a lot of organizations understand that. They'll be like, well, why don't we just have more respiratory therapy, or why don't we get more PT, or why don't we have more CNAs? All of those require those same clinical placements, the same ones that we're also trying to get into for nursing and nurse practitioner, and even our Masters of Education. All of those require, even now your RN to BSN requires clinical placements. So everything is requiring this kind of placement component, whether it's in the hospital or in the community. So just knowing the only way to grow any of the healthcare workforce, there really has to be these amazing partnerships. And again, not just with hospitals. I think everybody always thinks it's a hospital partnership, and it isn't. It's your communities, it's your schools, it's your outpatient, it's your mental health facilities, inpatient and or outpatient. Any of those things, even some of our ACOs that I heard were doing some of your home visits, all of these things work for these opportunities. So I think we also, as higher ed institutions, also need to look at the vast opportunities that are out there and create those partnerships for our students, because that's where healthcare is truly happening.